Assalamu alaikum friends. Welcome to my channel MBBS and BDS lectures. Today our topic is AIDS, which is related to general medicine. Before going to topic outline, if you want to watch the same lecture in Hindi or Urdu, I already upload the same topic on my channel in Urdu or Hindi. Go and watch that topic. But if you want to watch the AIDS topic in English, then this video is for you. Now we start from the AIDS. AIDS mean the words AIDS mean acquired immune deficiency syndrome. Now come to the topic outline. In this lecture, we study definition of AIDS, mode of transmission of AIDS, stages of AIDS, clinical feature, investigation, complication, management. First, definition. What is definition of AIDS? AIDS basically is a chronic syndrome in which our cell-based immunity become low. Why? Because HIV virus attack T cell type which is CD4, and when CD4 count become less, then our cell-based immunity become low and we prone to opportunistic infection, and the cause is HIV virus. Definition: AIDS is a chronic syndrome in which our cell-based immunity become low and we prone to infections, and the cause is HIV virus. This is the definition of it. Next is mode of transmission. In mode of transmission, we should remember one sentence strictly. The mode of transmission of HIV virus AIDS is through fluids like blood, vaginal fluids, milk, mucous membrane fluids. Now there are four modes of transmission. First is sexual, second is blood exposure, third is perinatal, and fourth is occupational. First, sexual. In sexual, through vaginal fluid, when male and female doing sex, and second is anal mucous fluids, when male and male doing sex, between male and male, and through vaginal fluid between female and male. Second is blood exposure. In blood exposure, like needle sharing, when one needle is used on two patients. Second is transfusion of blood product like blood plasma, like blood cells. This is the blood exposure second method. The third is the perinatal, transmission from mother to baby through milk. The fourth is occupational, like through hospital staff, through laboratory worker, because in hospital staff, from doctor to patient, from patient to doctor, and in laboratory worker because they also in direct contact with fluids like blood sample. These are the modes of transmission. Now come to the stages of AIDS. There are three stages of AIDS. First is asymptomatic stage, second is symptomatic stage, and the third is AIDS stage. Now first, asymptomatic stage means there is no symptoms. In asymptomatic stage, no symptoms of AIDS, only generalized lymphadenopathy is present. Mean there is a lymph node swelling in a whole body. Mean generalized lymphadenopathy is present. Why? Because in asymptomatic stage, the HIV virus enter in CD4 cell T cell and do its replication. Therefore, there is no symptoms, only generalized lymphadenopathy is present. The second is symptomatic stage. In symptomatic stage, there is a symptoms like fever, diarrhea, oral hairy leukoplakia, oral and vaginal candidiasis, weight loss. Now, what is oral hairy leukoplakia and what is oral and vaginal candidiasis? Oral hairy leukoplakia is basically opportunistic infection which is caused by Epstein-Barr virus, which is actually a white patches which present on the lateral surface of tongue and look like hair. Therefore, it is called oral hairy leukoplakia. Plakia means patches, leuko means white. Oral hairy leukoplakia is opportunistic infection which present in AIDS patient, and it causes Epstein-Barr virus. And what is oral and vaginal candidiasis? It is also a white lesion which is caused by Candida fungi. It is a fungal infection, also opportunistic infection. This is a symptomatic stage. The third is AIDS stage. In AIDS stage, complete AIDS develop, CD4 count become decrease, and immunosuppression occur. These are the stages of AIDS. Now we come to the clinical feature of. Now clinical feature. There are 10 clinical feature of AIDS. Number 1 is maculopapular rash on trunk. On patient trunk, there will be maculopapular rash, mean macule and papule. Number 2, fever. Number 3, weight loss. Number 4, clinical feature headache. Number 5, fatigue. Number 6, pharyngitis. Number 7, lymphadenopathy. Number 8, hairy leukoplakia. Number 9, oral and vaginal candidiasis. And number 10, diarrhea. These 10 are the clinical feature of AIDS. Now come to the complication. There are 13 complications of AIDS. Some are similar to clinical feature, but many are different. Number 1 is fever, diarrhea, maculopapular rash. These are similar to clinical feature, but anorexia are different. And oral and vaginal candidiasis are also similar to clinical feature, but next is different. In kidney, the complication of AIDS is nephrotic syndrome. In eye, retinitis, inflammation of retina. In blood, anemia, thrombocytopenia. In lung, TB, pneumonia. In heart, cardiac failure. In oral cavity, oral hairy leukoplakia. These 13 are the complication of AIDS. Now come to the investigations. In investigation, we use 3 investigation. Number 1, PCR, polymerase chain reaction. PCR are used to determine the viral load in our body. In our body, to determine the viral load, how many HIV viruses are present in body, we use the PCR. Next is the ELISA antibodies test. The ELISA antibodies test not only used for AIDS, but it is used in many infectious diseases to detect and measure antibodies. But here we use to determine antibodies against HIV in our body. This is the ELISA antibodies test. The third is CD4 count. We do the CD4 count of the patient. Normally, the CD4 is a type of T cells. Now, normal CD4 count is 800, but in AIDS it become less than 200. If CD4 count is less than 200, it show AIDS. These are the 3 investigation used for AIDS. PCR, ELISA antibodies test, and CD4 count. Now come to the final treatment. In treatment, we use antiretroviral drugs because HIV is a retrovirus. What is retrovirus? The virus whose genome consists of RNA instead of DNA. This is the definition of retrovirus. Now, we use antiretroviral drug. Now, antiretroviral drug have two types of mechanism of action. Now, our basic aim is to stop the replication of HIV virus in CD4 cell. Now, how we stop? We stop by two methods. Because for replication of HIV virus in CD4 cell, there are two things are responsible. Number one, reverse transcriptase enzyme, which form DNA, which form DNA from RNA. First, what is transcription? Formation of RNA from DNA is transcription, and their transcriptase enzyme is used from DNA to RNA. Now, from RNA to DNA, the reverse transcriptase is used. Then this virus DNA meet with our DNA and further processes continue. But if we inhibit the reverse transcriptase enzyme, then DNA is not formed from RNA, the process will be stopped. The replication will be stopped. The first drug is reverse transcriptase inhibitor. The next is protease inhibitor. What is protease? Protease is a basically enzyme which break the protein. Now here protease enzyme break precursor protein into small fragment. Then these precursor protein small fragment is responsible for replication of HIV in CD4 cell. If we inhibit the protease enzyme, then the small fragment are not formed from precursor protein. Then the replication will be stopped. Now come to the first mechanism of action, reverse transcriptase inhibitor, which inhibit the reverse transcriptase enzyme. The drug include abasavir, lamivudine, stavudine, ziduvudine. In reverse transcriptase inhibitor drug, at the end, woodine will be present. This is the identification of drug. Lamivudine, stavudine, ziduvudine, and abasavir. In protease inhibitor, which inhibit the protease enzyme, the drugs are at the drug end, navir will be present. Number 1, atazanavir. Number 2, endinavir. Number 3, lopinavir. Number 4, nelfinavir. Number 5, sakinavir. These are the 5 drugs which are protease inhibitor, which inhibit the protease enzyme. Now, treatment also complete. Now, we studied definition of its mode of transmission, stages, clinical feature, complication, investigation, treatment, or management. Now our topic is complete. If you like my video, click the like button and share the videos with your friends. And if you're new to my channel, subscribe my channel, press the red subscribe button and open the all notification in order to you receive every new video notification. For watching my video, I am very thankful to you. Thank you very much.